All righty. We are live. Hello, hello, everyone. Okay, so I'll start. It is National Minority Health Month. So Dr. Atkins and I wanted to just share some health tips with you all. I am Dr. Shayla Toombs-Withers. I am a board certified family physician and obesity medicine physician based in Chattanooga, Tennessee. And I also have a background in plant-based nutrition, as well as being plant-based. And so that is a large part of what I do in terms of teaching folks how to prevent and reverse chronic disease, by way of putting more plants on their plate, getting some movement in, and having some healthy mental health strategies along with that. So I'll let Dr. Atkins introduce herself.
I am Dr. Amanda Adkins, and I am board certified in internal medicine and lifestyle medicine, and I practice out in the Bay Area, California. I also have my own enlightenment health and wealth business to where we help women who are overweight get off medications that they take for high blood pressure and diabetes. So I'm excited to talk with Dr. Shayla today and everyone in the audience.
Awesome, awesome. All right. And so, in that it is National Minority Health Month, one topic Dr. Atkins and I wanted to focus on was diabetes because, our communities of color, people of color, are suffering at higher rates from diabetes. And, what we know about diabetes now is that it can be prevented and it can be reversed with some proper strategies. And so, we're just here to share some of that with you all.
Yes. So I love to talk about this. I actually just did a little talk with my patients because they always like, oh, what else can I do besides be on medicine? I don't want to be on medicine because I have diabetes. Or when they hear pre-diabetes, oh, I don't want to be a diabetic. So what can I do? So the first thing I always like to, just discuss is pre-diabetes versus diabetes and how we can prevent you from going from pre-diabetes to diabetes, and also know that having pre-diabetes is still a major risk factor because some people think, oh, well, I'm not a diabetic yet, so I don't have to worry about it. So, Dr. Shayla, what do you tell people when they say that they have pre-diabetes?
Yeah, yeah. So with pre-diabetes versus diabetes, we classify that, with lab results typically. And what we look at is if that the hemoglobin A1C. So if you've had your routine yearly physical, it should include a hemoglobin A1C, especially if there's anybody in your family who's had a history of diabetes. That should be one of the screening tests that's done. And so then we look at those numbers. And if your A1C is between 5.7 to 6.4, then you are considered to have pre-diabetes. And then over 6.5, you're considered to have diabetes. And so, what those numbers mean, though, is it gives us a picture really as to what your blood sugar has been doing over about a 3-month period of time. And so, those numbers tell us with pre-diabetes that your blood sugars are probably up close to 100, those low 100 levels that you're typically running, which normal blood sugar should be below that. Versus our diabetes patients, they're going to be on the higher end of that 100, so even 200s or more, depending on the level of control in terms of that blood sugar. And so that's what those numbers give us.
Yes. So, what question here I see that people ask is, how often should I exercise if I have diabetes? Or I'm going to include in pre-diabetes also.
Mhm.
I'll let you tell the audience what you tell your patients, and then
Yeah.
I'll go on after that too.
Right. Yeah. Yeah, for sure. And then one thing I want people to know too about prediabetes is that studies have shown that if you do have prediabetes, your chance of developing diabetes is much greater versus the person who doesn't have prediabetes. So it's definitely a time, even though it has, pre in the name, and it may not sound very important. But it is definitely a time that you still want to start to take charge of your health because you do have a much greater risk of developing type 2 diabetes after having that pre-diabetes diagnosis. But in terms of exercise, some things you can do really is just to get moving, because moving is going to be one of the ways that you can naturally lower your blood sugar. So even just 20 to 30 minutes going for a walk. I prefer for people to walk outdoors for a couple of reasons. One, natural sunlight helps to boost our mood and boost our energy level that way. Breathing helps to lower our stress, breathing in the fresh air. And so, you get some additional benefits beyond just
Mm-hmm.
the cardiovascular benefit of movement within itself. So getting moving, and really the key to that is movement that you enjoy doing. Because if I just go tell you you got to go run, a couple of laps every day, you're probably not going to do that if you don't enjoy doing that.
Right, exactly.
Versus if like dancing, you go dance, or if you like being out in the garden, you go do more of that, or like to play tennis, you go do that. So really the key is to find something that you enjoy doing that's going to get your heart rate up a little bit, and do more of that.
Yes, yes. I totally agree with everything you're saying. I also go a little bit further too for some patients, and going back to, we talk about pre-diabetes also, that there have been studies shown too that it does increase your risk for having a heart attack, or vascular diseases, or even kidney disease, even though you're not technically a diabetic. Even pre-diabetes can do that for some people. So I want to throw that in there for people too that are listening, because we have to be very careful. I still push people to do the exercising, like you said, some type of movement that they enjoy doing, and to emphasize though that your work is not exercise. So we want to make sure that
Yes.
we set aside time to actually intentionally move our bodies. So like I said, whether it's
Mhm.
dancing, walking, running, swimming, playing tennis, that you have a set schedule to where you do that. Because I always tell people, if it's not in your calendar, you're likely not going to do it. You're never going to have time to do it. So like I'll get to it when I get time today. No, that's not actually going to be beneficial. So you want to actually say, I'm doing it this time and this time. And I was just telling Dr. Shayla before I came on the call, I was doing my afternoon lunchtime walk. Like she said, being outside like that helps me to get through the rest of the day. So definitely
Mhm.
will agree with doing activity outside, because it's so much better for not only your physical health but your mental health. And I'm definitely a testimony to that. I
Right.
love doing that. Yes, yes.
Yeah, yeah, for sure. And one thing, I'll add, I actually like to use the term, especially with my coaching clients, we use the term intentional movement. And I call it intentional movement instead of exercise, because of the fact, like you said, it has to be something that you are definitely focused on, and that you're doing it for a reason. You're not just
Mhm.
saying, I'm sure you hear it as much as I do in the clinic, where people will be like, "Oh, I'm active every day. I have to go take the kids here, or
Mhm.
I
Mhm.
walk at work to my meeting," and that kind of thing.
Yes.
And it's like, no, it needs to be, actually intentional, saying, okay,
Right.
I am doing this because I know that I need to lower my blood sugar. So I know it's going to take, for me to do this for 20 minutes or whatever to do.
Yes. So that is so true,
I
because
think I
like
might have
I
froze
hear
a
that
bit,
all the
but
time.
yeah, so
Oh,
just more of that. Yeah.
yeah, with people always saying that, like you said, I'm moving around throughout the day, but that's not getting your heart rate up. So I tell them, yeah, that's good. It's better than sitting at the computer all day, but that's not your exercise. So let's pick something else. Oh me.
Right.
And the 150 minutes a week is, I would say, the minimum amount. Like sometimes people are, if
Yeah.
you're not moving at all, you definitely want to start moving, but your goal is to exceed that 150 minutes per week of exercise, the intentional activity that you're going to do. And because most people are like, oh, I do 30 minutes 3 times a week, and I've been doing that for the past 5 years. Well, come on, we can do a little bit better than
Right.
that, right, guys? So
Exactly.
I always try to push clients or patients to the next level when they actually hit a goal. Say, okay, well, it's time to move on to the next one. So let's go. So that 150 minutes
Right.
is that bar that you want to try to surpass.
Yeah, for sure. And, even within the realm of obesity medicine, the studies on obesity, they showed that to actually start to get some weight loss, you've got to be closer to that 45 minutes on 5 days a week. So that's a lot more, like you said, than that 150 minutes. That's just like the bare minimum. That's the
Hmm.
minimum bar. You really
Yes.
got to go beyond that to really get those extra benefits from this.
Exactly, exactly. One other question that people have here, and then we will let you guys ask questions or leave questions in the chat, and we're coming back in a couple weeks to answer more
Yeah.
questions. But I always hear this a lot too when people say, "I'm a diabetic. Can I eat carbohydrates?"
Yes, I love that question too. And I think you and I have chatted before, Dr. Atkins, and I think we've probably been practicing time. And I know in training, it was one of those things where we would send people to the diabetes educator, and they would come back and say, "Oh, I can't eat my apple anymore. I can't have my bananas that I like." But what we
Yes.
know now is that simply not true. Yes, you can eat your fruit. Yes, you can have carbohydrates. The key to it is the kind of carbohydrates that you're eating, and the other key to it is the amount of fat that you're eating, because it's typically the fat that's really making you more insulin resistant, and not that apple. There have not been any studies that have shown that eating too many apples cause diabetes. So it is not
Yes,
that.
please, please, please say that again. Say that again, because people say that all the time. Oh, I
Oh,
can't have no
right,
fruit because it increases my blood sugar. And I'm
right.
like, what?
Nope.
No.
Yeah, yeah, right. No, yeah, it's just simply not true. So you definitely, want to consume more plant-based foods. You want to limit that amount of fat in your diet, particularly that saturated fat, because that is what's going to make your body hold on to that sugar more, even, and help and contribute to more insulin resistance, which is what's feeding and causing that prediabetes and diabetes, and not so much the carbohydrates. Now, no, we aren't telling you to go out and get a bag of Oreos either, but we are saying that you want to
That.
eat those healthy carbs, the high fiber foods, the fruit with the skin on it, that you're getting those natural fiber from.
Yes, yes. So I'm glad you mentioned the fat because so many people they're so surprised when I mention that to them about the saturated fat. And I always like to bring up chicken too because people always think, oh, well, I eat a boneless, skinless chicken breast every
Hmm.
day. And I was like, well, I mean, if you still look at the amount of fat, saturated fat that is in chicken compared to a plant-based protein like your legumes, our lentils,
Right.
it is a big difference. And like you said, the fat, and I like the way that Dr. Michael Greger described it in the How Not to Die book of how we know that insulin is the key to unlock the door. And you're eating the foods and you're insulin resistant, but then there's a glue or something stuck in that lock, so you can't even put the glue, I mean the key in the lock. I thought that was a good analogy, so I had to use that again.
Yeah, that is.
So you got to get rid of that fat that's
Mhm.
blocking that lock. And so even though you may eat foods like your carbohydrates, like your fruits and some of the vegetables that you may think are higher in carbs, and you see your blood sugar go up after that, it's more because of the fat that's blocking it. Like
Mhm.
Dr. Shayla said, that is just causing the problem. So we definitely want you to eat the carbohydrates because the non-processed carbohydrates, let's be clear with that.
Right.
So that way you can actually get all the nutrients and the fiber and the benefits of other things you can get as far as your health and wellness when you eat those foods and not just trying to cut them all out and just get the fat and protein that you get like from animal-based foods. So yes.
Yeah. Yeah, for sure. Yeah.
Okay. So I
It's
was just looking to make sure that there's no questions that come up. I don't see any on my end.
right. No,
So
I don't. No, I don't see any here now, but we do invite you as you're watching this to leave questions even after. I always check back in the comments, and I'm happy to answer other questions too, as well as Dr. Atkins, I'm sure.
yes, so
For
we'll
sure.
be back here in 2 weeks
On
on
the
April
25th.
25th. Yes, the same time, 12:30 p.m. Pacific Standard Time, 3:30 p.m. Eastern Time. So we're both on different coasts. So
Right.
this is working out. So we'll definitely invite you
Yeah.
guys to ask questions and come back.
Right.
And if there's
And
another
Dr.
topic that you
Atkins,
want
just
to talk
tell
about,
them. where they can find you
Oh,
for
yes.
all of our.
So definitely. So you can find me on Facebook and Instagram, and just started a new TikTok. For people on that. And it's Dr. Amanda Adkins on all platforms. I also have my website at dramandamd.com. And of course, if you are looking for a health coach, I definitely will. You can invite you to book a call. You can do that on my website. Or like I said, ask questions. You can send us a DM. What about you? Where can they find you?
Yeah, so yeah, Dr. Shayla Toombs-Withers. I can be found on most platforms under Essence of Health Wellness Clinic. That's on Facebook and Instagram. I'm also on YouTube at EOHWC Video. I have a podcast, Essence of Health Tea Time Podcast, where you can get all things health, wellness, and plant-based nutrition every Tuesday on your favorite podcast platform. And then I'm also into health coaching too, and that's at eohcoaching.com, where I also will be happy to do a consultation with you. And we'll, between Dr. Atkins and I, we can certainly get your health on track.
We will. We will. So
Yeah.
reach out to us, and we will look forward to seeing you guys in a couple weeks.
All righty. Bye.